This is the injury report presented by NYU Langone Health. The MLB season is right around the corner and spring training has already kicked off. Both the Yankees and Mets have players either dealing with or coming back from a major injury. So let's break down their surgeries and their road back to the diamond in today's injury report with Dr. Abigail Campbell. She's the director of NYU Langone's Center for Women's Sports Medicine. Doctor, thank you for taking time out of your busy day to join us. You have two fan bases that are locked into this interview because they both suffered disappointing seasons last year and major injuries to some of their star players. Let's start with the Mets. 'Tis the season for the return of the trumpet. Mets closer Edwin Diaz is back on the mound after he suffered a torn patella tendon, celebrating a win at the World Baseball Classic last March. Can you break down the type of surgery that Diaz needed and the long rehab process?
Poor guy. I hope the celebration was worth it. And what a rare injury to see in baseball players. It's basically the patellar tendon is kind of a sheet of tissue. It basically connects the kneecap, the patella, to the top of the shin bone, the tibia. And that's super important for function of the quad. Because when you fire your quadricep, if there's nothing attached, your shin's just going to flop down. You're not going to be able to kick and generate any power whatsoever. So the surgery itself is actually really straightforward. All we do is put a bunch of stitches in through the tendon, stick it back down onto the bone, and that heals over 3 to 5 months. The tendon healing itself, though, is really not the limiting factor with return to play. It's the quad muscle itself. Because for that first few months after the surgery, you have to protect it. Because if you let them start, say, squatting with stitches holding the tendon on the bone, it's going to rip right off. So you kind of have to shut that quad down for the first few months to let the tendon heal to bone. During that time, unfortunately, you lose 80 to 90% of that quad strength. And then you start the strengthening phase after 3 months, 4 months, 5 months, depending on the complexity of the repair and how it's healing. So it's really the uphill battle starts in the second phase of rehab, essentially once the tendon's already healed, to get that quad strength back. And usually we start strengthening around 3 months. People are back to working out, a little jogging at 6 months, and usually full play is anywhere from 9 to 12 months, but it can take a year or more to regain that full quad strength. I would hope, and assume that Diaz has access to all of the cutting edge rehab protocols, all the fancy machines and toys we have to get that muscle to wake up. But unfortunately, we can't control what the body's going to do. And I hope that 11 months out, he's going to be fully back to strength and be able to do everything he should be at this time point. I would expect him to be full blast.
Well, I'm glad you said that because that leads us into the next question. Like you said, we're about 11 months out since that injury and the surgery. That type of surgery isn't really common in baseball, like you said. Will he be back at 100% on opening day, and will he be dealing with the effects from the injury throughout the season?
I feel confident he will be. Once it's healed, it's healed. Once the quad's back to life, it's back to life. It's not one of those injuries like, say, a fracture that goes through the joint, even a ligament reconstruction, if there's cartilage damage, things like that. There's not things that linger that result in arthritis kind of problems such as that to worry about long term. Once it's healed, these injuries are pretty much good to go, and it's a very low re-tear rate. It sounds like he's done the full appropriate rehab. I mean, some people would even be pushing it to play earlier. So the fact that he's 11 months out, I think he should be able to do everything, and I'm not too worried about this being a long-term issue for him.
Does he have to worry about any injuries that he could suffer from overcompensating for that patella, the leg that he did mess up?
I mean, as a right-handed pitcher, it's the right knee. So if anything, it should be relatively protected since the left knee is seeing a lot more torque throughout the pitch. So I think it should be pretty safe. I think the only thing is the jumping, pivoting. If there is any residual weakness, which I would hope there's not at this point, say the knee gives way from the quad being weak, he could tear the meniscus or ACL or something like that, but that's exceedingly rare at this point.
The Amazons are feeling amazing with that news that you just gave them on the injury report. Let's head on up to the Bronx because the Yankees have also been banged up. We'll start with outfielder Jasson Dominguez. He underwent Tommy John surgery back in September. I feel like Tommy John surgery to baseball is what ACL surgery is to us football players. So what does Tommy John surgery actually involve, and why is it so common for baseball players?
Tommy John surgery is basically a ligament reconstruction, so similar to ACL. where we basically have to make a new ligament from a ligament that's torn. And it's really common in baseball players to have this kind of gradually happen over time. Once in a while, it is just a one-time snap where the ligament gives way. But more often, with the repetitive torque that you're constantly putting through the elbow, you're basically getting micro tears, and at some point, the elbow hits an inflection point and the tendon becomes essentially not good anymore. And then they get this dead arm, their accuracy, their velocity goes down, and they can't throw what they could before due to pain and the fact that the ligament's basically baggy. So what we do in the surgery is we take something else to make a new ligament, because if we stitch that ligament back together that's already baggy, it's not going to do what it's supposed to. Most common is we take a ligament from the wrist and basically weave that through the bone to create a new UCL, which is the ulnar collateral ligament, the Tommy John ligament on that inner elbow there. Sometimes we also use cadaver tissue because not everyone has that tissue available at the wrist to take. Either way, the results are pretty good, but it is very slow healing. It's not like a broken bone where you fix it and it heals in 6 weeks. Ligament healing, it not only needs to heal down into the bone, but it needs to create new collagen, blood vessels to kind of function as a normal ligament, because we're trying to trick the body into doing something that it's not naturally there, right? And so the rehab for pitchers is a bit longer than non-pitcher players. The throwing program usually starts around 4 to 5 months. So I think we're around the 5-month time point for him. I think it's reasonable that there's some reports of him doing a bit of throwing program, but it starts really light, like 40 feet, really slow, and it's gradual from there. For pitchers, we're talking 12 to 14 months, sometimes even longer for full play. For outfielders and other position players, it could be less than a year, but you really have to be careful because the studies show that if you go back too soon, the re-tear rate is unfortunately quite high.
So there is a chance that he could be back this season, but it's something that you think the Yankees will kind of slowly bring him along. So he may not play until maybe summertime, you think, late summer, you think?
I would think so.
Okay.
There's a chance less than a year because he's not a pitcher, but okay. Fingers crossed. It all depends on how the strength is coming along and the motion and the rehab. And during this whole time, obviously, they're working on throwing mechanics, things like that, to tighten everything up. Because if it happened in the first place, it was either overuse or things were off in the throw.
All right, well, let's talk about a pitcher who underwent Tommy John surgery, and he's another Yankee, pitcher Scott Effross. He recently had surgery to improve some lingering back issues as well. So what's that rehab process like coming off of 2 surgeries?
Poor guy. So for the Tommy John, his surgery was in October of last year. So according to the normal timeline as a pitcher, he would be expected to come back to spring training, and the back surgery he had was in December. Maybe you have more intel on this, but I was not able to find exactly what was done. It really widely varies on which surgery he had. If it was a tiny little, what's called a microdiscectomy, where basically there's a disc bulge that got trimmed out, no metal was put in, it's basically like a little tiny surgery, that rehab can be fairly fast. But if there's other things like needing to put bars and rods and screws in there, that can take significantly longer. But overall, it is concerning looking at it from a surgical standpoint, right? During that whole time, like we just talked about, when you're rehabbing a Tommy John, you're working on correcting any pitching mechanics that were off that caused the injury in the first place. And if you think about what that's doing to the spine, right, there's a lot of torque through the back during a pitch. I worry that there may have been something awry in the throw all along that's resulted in this back problem popping up. And I think that over the next 6 months, people are saying summer return for him. It really needs to be ironed out how he's pitching and what the spine's doing, what the core is doing, what the pelvis is doing, what the arm is doing, just to prevent any of these things from popping up again as we wait for them both to heal.
So what do you think Yankees trainers and doctors are looking for throughout this rehab process and this pitching process to know that, oh, there's a red flag, let's shut them down? How much is too much when it comes to pushing it in the rehab process?
So from the Tommy John standpoint, the ligament at this point should be pretty much healed. But it's not just the ligament, right? There's the whole arm attached to it. There's all of the muscle groups. There's the pitching mechanics. So I would expect at the level that he's in, there's going to be a lot of video analysis, a lot of coaching on fine-tuning the pitching mechanics. And then for the back rehab, I'm still not sure if he's waiting on things to fuse or if it was just a trimming and letting the skin heal. But he kind of just needs to juggle both. And the ligaments essentially healed at this point. The back is still a question, but I think they're going to be really, really closely watching his strength and his mechanics over the next few months.
Thank you, Dr. Abigail Campbell. That was awesome. We learned so much just now. And again, thank you for taking time out of your day. Have a great rest of your day. That was awesome.
Thanks for having me.